Hello, everyone. Thank you so much for joining us today. My name is Marcia. I'm the webinar director here at Advice Chaser. Before we introduce our guests and get started, I do need to do a little bit of legal housekeeping. Advice Chaser, the host of this webinar, is not a registered investment advisor. We cannot and do not give financial advice. This presentation is for educational purposes only and cannot be considered advice for any person's individual situation. Advice Chaser regularly hosts informative webinars such as this one, featuring a variety of knowledgeable professionals, many of whom are licensed advisors. Any opinions, ideas, jokes, or principles expressed by presenters are their own, and however true, funny, or interesting, are not endorsed by Advice Chaser. Please do not act on the information you hear today without consulting a qualified financial professional. Well, we are thrilled to bring you today's educational presentation and a couple of housekeeping items. Attendees are muted, but we do encourage you to ask questions using the chat box, and I'll make sure to be monitoring those. There will be a question and answer period at the end of today's presentation. In addition, if we're not able to get to your question during today's presentation, go ahead and leave your contact information with your question, and we'll be sure to make sure someone reaches out to you after today's event to address that. Once again, please don't hesitate to ask for clarification or expansion of the material. We're happy to address those questions today. Well, I am going to pull up really quickly I'm sorry here, Andy. I just need to pull up your bio here.
Sorry, I apologize.
No worries.
Got ahead of myself there.
That's all right. I'd love to introduce our presenter today. Andy Hardwick is a Metropolitan Public Affairs Specialist for the Social Security Administration in Houston, Texas. Andy graduated from Brigham Young University with a degree in modern languages, subsequently earning a master's degree in modern psychology. He started working for Social Security in the New York City area in the disability program. Since coming to Houston, Mr. Hardwick has been involved in public outreach for the Social Security Administration. He's also presented several times with Advice Chaser. So we want to welcome you back, Andy. And we can't wait to hear what you have to say about kind of a primer on Social Security. I'm going to go ahead and stop my share and let you take over.
Thank you very much. Pleasure to be here today. Here we go. Just make sure we get this. All right, can you see that? Good. Okay. Well, thank you, Marche. As Marche said, I am a public affairs specialist for Social Security. I work here in the Houston area. Actually, I'm public affairs specialist in all of Southeast Texas, but I'm home based in the Houston area. So today we're going to talk about Social Security. We have 3 programs. Of course, most people think of us with the retirement. That's what the common perception is. But besides retirement benefits, we also provide survivor insurance. Insurance is the old term, but benefits is the more modern term, I guess you would say. But if a worker passes away, his or her family is protected. Minor children can receive benefits, as well as the widow or the widower. Disability benefits, if a worker becomes unable to work because of a physical or mental condition that's going to keep him or her out of work for at least 12 months, they could receive disability benefits. And disability pays you the same as though you're a full retirement age. So we have those 3 benefits under Social Security: retirement, survivor, and disability. So how do you earn Social Security? How do you earn the right to get Social Security? It's not a freebie. It's not a government giveaway program. In order to receive your own Social Security or to receive Social Security under someone else, you or that other person has to have earned enough work credits. Credits is the modern term. The old term was quarters, right? So the minimum amount of quarters or credits that you need to get your own Social Security when you become retirement age is 40. All right, the maximum amount of credits you can get per year is 4. For every $1,510 you earn, $1,510 you earn, whether it's in a day, a week, a month, for every $1,510 you earn, you get 1 credit, 1 work credit. Once you reach 6,040, you've gotten your 4 credits for the year. That's the maximum amount of credits that I can get per year. So whether I earn this year 6,040 or $60,040, I don't get more than 4 credits. Over my lifetime, I have to have accumulated at least 40 credits in order to draw my own Social Security. Now, the earliest age that I can draw Social Security for retirement is 62. That has not changed. So that's always been the age is 62. But at 62, you get a lower payment, all right? The maximum retirement age, or well, I should say the full retirement age, is anywhere from 65 to 67, depending on when you were born. If you were born between 1943 and 1954, your full retirement age is 66. If you were born between 55 and 59, it's 66 and 2 months, 4 months, 6 months, and so on. If you were born 1960 or later, full retirement age is 67. So if my full retirement age is 66, but I decide to take benefits at 62, 4 years before my full retirement age, my benefit will be reduced. Why? Because I will be getting more checks, all right? If I get 12 checks per year and I'm getting them 4 years early, that would mean a potential extra 48 checks. So let me give you an example. Let's say that my benefit were $1,000 a month at 66. And that were my full retirement age. If I take benefits at 62, 4 years before that, and get those 48 extra checks, that $1,000 a month benefit is reduced to about $750 a month. So I get about approximately a 25% reduction. And it does not change when I reach 66. Why? Well, because I got all those extra checks. So I have to decide for myself, do I want to take retirement early and get more checks, or wait and get a higher amount on my Social Security? Now, there's another thing. If you take retirement before, or you take Social Security before your full retirement age, you have a limitation on how much money you can earn if you're still working. And we'll talk about that in a minute. So you might try to file for Social Security at 62, but if you're still working and if your earnings, your wages are over a certain amount, you might not be able to get anything at that time. But now once you reach full retirement age, your wages will not reduce your Social Security at all. It doesn't matter then. It won't affect your Social Security amount. But before then, if you try to take Social Security before full retirement age, then your wages could have an impact on your check. Now, more and more people today are not retiring at 65 or 67 or somewhere in between. They're enjoying their jobs too much. They want the extra money. They don't want to be around the house and just kind of sit on the couch and have nothing to do, whatever. They just, like the extra money, enjoy what they do, and that's fine. If you delay taking your Social Security past your full retirement age, for every year you delay past your full retirement age and age 70, your benefit goes up by 8%. It does not go up past age 70. So that same $1,000 a month that I would theoretically get at 66, at 70 becomes $1,320 if I want to wait an extra 4 years. So the question is, well, should I take it early or at full retirement age or later? It depends on your individual situation. Okay. Some people, if your health is precarious and maybe in your family, not a lot of people made it to 70 or maybe they passed away in their very early 70s. Well, maybe you think, well, I want to enjoy my money, so maybe I should take Social Security at my full retirement age. If it's 62, you have some health issues and your work is stress producing and stuff, well, don't get yourself sick. Then you have the option of taking retirement early and getting to enjoy your money, even if it is at a lesser amount. So here's a chart that kind of summarizes everything that I've been telling you. That $1,000 benefit, of course, would grow by 8% for each year I delayed taking Social Security if my full retirement age were 66. Now, by the same token, the earlier I take my retirement, and the earliest would be 62, that $1,000 is reduced. Now, I will tell you, people ask me all the time, well, what if I don't wait a full year? What if I take my retirement, let's say at 66 and a half? Well, then instead of getting an 8% increase, you would get about a 4% increase, because really the increase is divided by number of months. But I'm not gonna, we just say for simplicity's sake, 8% per year. But depending, like I said, if you retire at if your full retirement age is 66 and you take it at 67 3/4, well, it's going to be, it won't be 16% higher. It'll be 8% for the first year. And then for the next year, if it's 3/4, then it'll be a different amount. It'll be slightly less than 8%. So, but now remember, again, after age 70, it doesn't go up anymore. Now, if you are receiving benefits, so can your spouse, if your spouse is at least 62. Even if they have never worked, they can get benefits under you. Now, if they file for spousal benefits at full retirement age, they get an amount equal to 1/2 of what you get, and that does not reduce your benefit. If they file at 62, then they get an amount equal to about 1/3 of what your benefit is from Social Security. Now, your children can get benefits until they're 18, just by virtue of being minor kids. So if you have any minor children, they will receive benefits until 18 or 19 if still in high school, or past that if they have a serious disability. All right. If your spouse is not yet 62, but caring for kids that are disabled, your spouse could receive benefits for caring for a disabled child. If your child is under 16, your spouse could receive benefits under you regardless of their age, until the youngest child in the family turns 16. Then at that point, if your spouse isn't at least 62, then their benefits would stop. Now, in order for you to draw benefits under your spouse, they have to be collecting. All right. If I file for benefits under my wife and she's not receiving Social Security, they're going to deny my case. They're going to say, you can't get spousal benefits if your wife is not collecting. All right. But in the case of divorced spouses, if you file under an ex, your ex does not have to be collecting Social Security in order for you to receive benefits under him or her. As long as both of you are at least 62, you are married at least 10 years, divorced 2 years, and you have not remarried. It doesn't matter if your ex remarried. If you have not remarried, then you can file for benefits under your ex. Okay. So you have to be married. This is in the case of an ex, 10 years, divorced 2 years. Both of you have to be at least 62, and you cannot have remarried. Okay, if you did remarry, then after your current marriage ends, you could file under an X. Or if you were married to two people, at least 10 years each, even if you divorced those people, you could file under one or the other, under whichever one you could receive more money. Okay, and again, that would not have any effect on their benefits or any benefits that their current spouse could get under them. All right, so if you file for spousal benefits at your full retirement age, you get an amount equal to 1/2 of what your husband or wife is getting. If you file at 62, you get an amount equal to 1/3 of what they are getting. And as I said before, this does not reduce their benefit at all. All right, now, I just told you that if you waited to take your Social Security past your full retirement age, you could get that 8% increase every year. All right, so you might think to yourself, could I delay taking my own Social Security till age 70, but in the meantime, I have a spouse who's collecting or will be collecting Social Security? Can I file under them and get spousal benefits while I'm waiting for my own benefits to keep growing until age 70? Yes, you can do that, but only in certain circumstances. The rule used to be if you were full retirement age, you could delay taking your own benefits and file what we call a restricted application saying, oh, I only want benefits as a spouse. I don't want my own because I want them to keep growing. Now you can only do that if you were born before January 2nd, 1954. If you were born January 2nd, 1954, or afterwards, whenever you go to file for benefits under your spouse, Social Security is going to make you file for your own benefits and give you whichever one is higher. So if you were born before January 2nd, 1954, and you are full retirement age, you still have the option of telling Social Security, I only want to get benefits under my spouse. I don't want my own at this time. But if you're born January 2nd, 1954, or after, whenever you go to file for benefits under your husband or wife, we're going to make you file for your own benefits, and we'll give you whichever one is higher. Now, that doesn't apply to widow or widower's benefits. If your spouse predeceases you, you could apply for widow or widower's benefits, even if they're reduced, and then later file for your own at age 70. All right, so here's the chart that explains what the full retirement age is. So as you can see, people born between 43 and 54, their full retirement age is 66. And between 55 and 59, it's 66 and 2 months, 4 months, and it keeps going up until you reach 1960. Then anybody born 1960 or later, their full retirement age is 67. Nobody has a full retirement age higher than 67. So how do we figure out your Social Security benefit? Basically, we use your highest 35 years. Well, I just told you, you really don't need 35. You could just, with 10 years of work, if you have 40 credits, you're good. You can collect Social Security at age 62, if that's what you want, okay? But if you don't have the 35 years, if you haven't worked 35 years before you retired, all those, let's say you work 10 years and nothing more after that, you're going to have 25 years of zero, and that's going to pull down your average slightly. All right, so if you retire and you had 40 years of work, we're going to use your highest 35 years. If you retire and you had 30 years of work, we're going to use all 30 years, but you're going to have 5 years of zero. Now, the good news is, let's say that you start collecting, but you return to work or you continue working. Every year that you continue working, if one of those 35 years is a 0 year, or if what you made for the year is higher than one of those 35 years, we will take out your lowest year or take out the 0 year, put in what you made for the year, and refigure your benefit. And that will continue forever and ever as long as you keep on working. That doesn't stop at age 70. So as long as you keep on working, at the end of the year, we'll always see if what you made for the year is higher than one of the 35 years we used, or one of the 35 years we used was a 0, we'll take that out, put in what you made, and refigure your Social Security benefit. Now, in most cases, if you get a pension from a company or from a former employer, we don't care. That does not affect your Social Security. However, if the pension comes from a place that did not take out Social Security, like sometimes school districts, then that pension you get could affect your Social Security. It could lower it. Okay, that's called the windfall elimination provision. Windfall elimination provision. But that only affects you if that pension is from a company or former employer that did not pay into Social Security. You can look at your pay stub. It should say either Social Security taxes or FICA, F-I-C-A. If it says that, then you're good. Then that means your employer is paying Social Security. Then we don't care about your pension. It's not going to affect your Social Security. Okay, that one, the windfall elimination provision affects your own benefits. But there's another goodie that affects spousal benefits. That's called government pension offset. Remember, I told you that if your spouse is receiving benefits and you file under them and you are full retirement age, you can get an amount equal to 1/2 of what they get, okay? But if you are also receiving a pension from work that you did from a place that didn't put into Social Security, didn't take out Social Security while you were working there, then 2/3 of that pension counts against any spousal pension you could get. So let's say that my wife is getting $2,000 a month from Social Security, and I am full retirement age, and I want to file for spousal benefits. Well, normally I would expect to get about $1,000 a month under my wife. But let's say that I am a retired teacher from a district that didn't pay into Social Security. And let's say my teacher pension is $3,000 a month. Well, under the government pension offset, Social Security counts 2/3 of any pension from a job that didn't take out Social Security. It counts that 2/3 of that pension against any spousal pension I could get from Social Security. So if I'm getting $3,000 a month from a former employer that didn't pay into Social Security, and Social Security is going to count 2/3 of that, that would be 2,000. So 2,000 subtracted from the 1,000 I could get as a spouse under my wife is minus 1,000. So I wouldn't get anything as a spouse. That's called the government pension offset. So those are two provisions that affect people who are getting pensions from places that were not paying into Social Security. All right, so the easiest way to file for Social Security is through your My Social Security account. Don't have one, just go to ssa.gov or socialsecurity.gov. And right there on the home page, you're going to see an icon there that says want to open a My Social Security account. Click on that. And if you're at least 18, have a US mailing address, and have a Social Security number, you should be able to open a My Social Security account for yourself. And what's the advantage? Well, you know, the letters that we send out every year, we call the Social Security statement. Those are sent out to people 60 years old or older. Suppose you're in your 50s and you want to know, well, what could I get from Social Security once I retire? Or what if I waited to age 66 or 67, my full retirement age? Or what if I waited to 70? What if I became sick? What if I died? How much would my widow get? All that information is available from your My Social Security account. It's also important, you want to check that account every year, or whenever you can check it anytime you want. But you want to do that, you want to check it at least once a year to see if your wages are posted to your work record correctly. If there's any anomalies, if you see anything there that looks kind of funny, you worked last year, but it's showing up as 0. Well, wait a minute, something's wrong there. You can contact Social Security, bring a W-2, a letter from your employer, or a copy of your income tax forms, and we will correct that for you. Okay, so if you notice something funny, as long as you bring the proof, W-2 or something from IRS to show or a letter from your employer, we can correct that. So you should be checking your work record every year to make sure that you're not being cheated out of any future benefits. And once you get into payment status, you can change your phone number, change your address. You can change banks where your checks go. You can do all of that. Download a 1099, download an award letter. You can do all that through your My Social Security account. If you file a claim, you can follow the progress of your claim through your My Social Security account. All right, so remember I mentioned to you that if you file for Social Security benefits early for retirement benefits and you're still working, that could cut into your benefits. So the limit this year, and this only refers to wages, not interest, not any income generated from 401s or anything like that. This is only if you're still working. You can make up to $19,560 gross for the year. For every $2 above that, Social Security will reduce your benefit by $1 if you're working and collecting benefits early. Okay. The year you reach full retirement age, that limit of $19,560 goes up to $51,960. For every $3 above that, Social Security would reduce your benefit by $1. But the month and year you reach full retirement, all limits are off. And you can make as much money as you want, and it's not going to cut into your Social Security at all. So how do you apply for Social Security? Go to socialsecurity.gov or ssa.gov. The easiest way is online. Okay, online is the easiest way. Same thing with Medicare. The easiest way is online, socialsecurity.gov or ssa.gov. Then you'll see icons there. One will say retirement, one will say disability, one will say Medicare. So click on that, and that will take you to the right place. Okay. Now, the alternative, if your claim is a little bit complicated because maybe you were married before, or you have children with disabilities or something like that, you'll probably need to call us on the phone. You probably get a pop-up that will tell you that you need to contact your local Social Security office. Well, go to socialsecurity.gov, scroll down to where it says contact us, click on that box, and then scroll down to office locator, put in your zip code, and then you'll get the phone number and the fax number of your local Social Security office. That's where you should call first before you call the 800 number. But you also have the option of calling 1-800-772-1213. Now that 1-800 number is open Monday through Friday from 8 a.m. to 5:30 p.m. No, I'm sorry, 5:30 p.m. Okay, 8 a.m. to 5:30 p.m.
I just wanted to pop in here. We're getting a couple comments about, can we get a copy of the slides? We will be sending out a replay of this recording to our guests. So make sure that you check your email for that. And I know there are questions coming in, but we're going to address those in the question and answer period. Go ahead, Andy.
Okay, thank you. All right, so what about survivor benefits? If a worker passes away, his or her widower or widow can get benefits as early as 60. Now, those benefits are reduced. They're 71.5% at age 60. And since the widow or widower is not yet full retirement age, because we know that full retirement age is 65 to 67. So they get 71.5%. If we have a widow or widower that's as young as 50 and they can't work due to serious disability, they could also get 71.5% of what the deceased worker was due. Now, if the widow or widower waits till their full retirement age, they get 100% of what their deceased spouse was due. Now, in that case, if you get benefits as a widow or widower and you remarry after age 60, your benefits could continue. Okay, they don't get cut off because you got remarried, but the remarriage would have to occur after age 60. All right, and survivor benefits also pays benefits to your, we talked about widow, widower, but also pays benefits to your children who are under 18 or 19 if they're in high school, or beyond that if they are if they have a serious disability that began before age 22. Okay, so disability is a physical or mental condition that's going to keep you out of work at least 12 months or has lasted 12 months. Right. So disability, and now generally, if you're over 31 years old, you must, in the last 10 years before you got sick, before your disability prevented you from working, you have to have at least 5 years of work out of the last 10. So if I became sick in 2022, that means in 2012, between 2012 and 2022, the last 10 years, where I could have gotten a possible maximum 40 credits, I need at least 20 to get disability. But now that's not the only thing. All right, the disability claim goes to a state agency called Disability Determination Services, DDS. In Texas, they're located in Austin. In every state, it's usually located in your state capital, and they make disability decisions for Social Security. They get the medical part of your claim, and they contact your doctors, hospitals, clinics to get all that information. Okay. And also, like with survivor, like with retirement, if you have a spouse, they could get benefits under you if they're at least 62, if you're collecting disability, or if they're caring for kids under 16. They could get benefits until the youngest child turns 16. The kids can get benefits till 18 or 19 if they're in high school. Okay. So we have something called advanced designation of representative payee. If you are worried that maybe in the future something could happen, dementia or Alzheimer's, you can designate 3 people who could possibly get checks in your name and do business in your name if you became incapacitated. Okay, so you just put that down. That doesn't mean that those people are going to be getting. That means if you come to a point where you can no longer handle your own benefits, we would contact those people and see if one of them could serve as your representative as far as Social Security goes. It's kind of like power of attorney. Okay, so let's talk about Medicare. So remember, I mentioned that the full retirement age change used to be 65. Now it's anywhere from 65 to 67, depending on when you were born, your year of birth. So 65 is the earliest you can apply for Medicare, unless you are on disability. If you're on Social Security disability, which is sometimes called SSDI, if you're on Social Security disability, after 24 months, you automatically get enrolled in Medicare A and B. Okay, we enroll you in Medicare A and B after 24 months. You get your Medicare card through the mail. Now, if you're getting Social Security prior to age 65 and you're not on disability, okay, we are going to mail the Medicare card to you, having enrolled you in A and B, and you'll get it about 3 months before your 65th birthday, but that will be effective the month and year you turn 65. Okay. Now, again, if you're on disability, after 2 years, after 24 months, you will come on Medicare and you'll get that card mailed to you. Now, everybody who's on Social Security disability, unless they turn 65 before the 2 years are up, they have to wait 24 months before they come on disability. Unfortunate rule that they came up with when they created Medicare, but I don't know why they did that. But anyway, if you have Lou Gehrig's disease or permanent kidney failure, you don't have to wait the 2 years to come on Medicare. But if you have another type of disability, unless you turn 65 before the 2 years are up, and most people are not in that category. Most people getting disability are much younger than that. So they have to wait 2 years unless they have Lou Gehrig's disease or end-stage renal disease. Then those folks don't have to wait the 2 years to come on Medicare. All right, so Medicare has 4 parts, A, B, C, and D, but 3 times when you can enroll. All right, if at age 65, I am not working or I am not covered. Okay, let me put it this way. Let me clarify that. If at 65, I'm not working or I am not covered under a working spouse's employer health plan, I need to enroll in Medicare during the initial enrollment period, which is 1, 2, or 3 months before I turn 65, the month I turn 65, or 1, 2, or 3 months after. That's the initial enrollment period. If I miss that, I can only enroll in Medicare during the general enrollment period, which is January to March of each year. If I'm working at 65 and have health insurance through my employer, or I have a working spouse and I have health insurance through her employer, okay, then I do not have to enroll in Medicare until my spouse stops working if I have health insurance through her, or I stop working if the health insurance is through my employer. Then I have 8 months to file for Medicare without a penalty. But if I miss that, then like the people who missed the initial enrollment period, I'm going to have to wait to from January to March of each year. Okay. And for every year I was late in filing for Medicare Part B, okay, that premium goes up by 10%. So if I'm 2 years late, 20%, 3 years late, 30%, and so on and so forth. All right. So Part A covers most inpatient services the first 60 days. Now there's a deductible of $1,556. That's on me, and the next 60 days is covered by Medicare. Part A. That doesn't cost you anything. If you have your 40 credits or are filing under a spouse who has 40 credits, that doesn't cost you anything. Part B, that's the one that is a premium of $170.10 every month. So if you're collecting Social Security and under Medicare, we will take that from your Social Security check automatically, $170.10. That covers 80% of your doctor visits after you pay the deductible of $233. So if you pay, let's say, $60 a visit, after 4 visits, that's $240. You're $7 over the deductible. So from that point on, you're just going to pay the 20% of the normal $60 you would pay your doctor. Okay. So after you've paid your doctor $233 for the year, then from that point on, you only pay your doctor 20% of what they would normally charge you for a visit. And again, this one is $170.10. This is the one that goes up by 10% for every year you were late in filing. Now, if I go and enroll in Medicare at age 70, that's 5 years past my 65th birthday. So you would say, well, 5 years, that's a 50% penalty because it's 10 years late for every year. Yes, I would pay the penalty unless the reason I didn't file for Medicare was until 70 was because I was working and had health insurance through my employer. As long as it hasn't been more than 8 months that I stopped working, I am protected under that special enrollment period and I don't pay a penalty. So my premiums are not going to be higher because I'm filing for Medicare at 70. I'm filing 5 years late. Okay, so it's important to remember. So that's Medicare A and B. That's what we sign you up for, Medicare A and B through Social Security. However, we do not sign you up for C or D. All right, so let me explain to you what Medicare C and D are. All right, so if you have original Medicare A and B, all right, that's what we call original Medicare. They cover the hospital and the doctor, but you don't have any drugs that are covered unless you're in the hospital. If you're in the hospital, then Part A would cover that. But once you get out of the hospital, you don't have any drug coverage. Okay. So if you want prescription drug coverage, you need to sign up for Medicare Part D. Now, unlike A and B, you don't come to Social Security for that. Part D Medicare is through private plans. So you can go to 1-800-Medicare. That's 24/7 live service, 1-800-Medicare, whatever those letters stand for, or Medicare.gov, and click on Plan Finder, put in your medications, and it will give you the 3 most economical plans that cover most or all of the medications that you take. If you develop a condition during a year that requires another medication that's not on your plan's formulary, they will have to cover that medication as long as your doctor sends a letter saying you must have that medication and none other. Okay, so that's Part D, Medicare Part D, if you have traditional Medicare or original Medicare A and B. Now, you might be looking for a plan that would have D built in. That would be Medicare Part C. Medicare Part C can be either a PPO, which does not have drug coverage, or an HMO, which does have drug coverage. So if you are on Medicare A and B and you want drug coverage, you can either sign up for D, which is an extra $30, $32 a month, depending on your plan, and there's co-pays and deductibles, or you can switch to Medicare Part C, in which case, if you get the HMO type plan, you drop the Part D, all right? And in most cases, your Medicare Part C plan, or in many cases, the $170.10 that Social Security was taking out for your Part B, we will turn that over to your Part C plan, and that will pay for your Medicare Part C. So you don't have an additional premium. And that includes, that has a drug plan, and it covers doctor visits and hospitalization. So it can be a real money saver for a lot of people. Okay. Then there are also people that have traditional Medicare. I have heard of these Medicare supplementary plans. That is not the same as Medicare Part C. A Medicare supplementary plan fills in the gaps that A and B don't cover, but that can be expensive. And I mean, not everybody, it doesn't really work out for everybody. So if you're looking to save money, Medicare Part C is probably the way to go. And there are times during the year when you can switch from one C plan to another, or you can drop it during open enrollment from October 15th to December 7th. You can say, these Part C plans are not working for me. I want to go back to original Medicare, in which case then starting January of the following year, you would be back to original Medicare. All right, so this is the Medicare number. The letters stand for 1-800-633-4227. I recommend you call them after 5 p.m. Don't call them during regular working hours. The lines are extremely busy. Call after 5 p.m. You could even call at 12 midnight. You're going to get a live person. You can call on weekends. You're going to get a live person. Or go to their website, medicare.gov. All right, so let me just mention briefly SSI, not to be confused with SSDI, which is Social Security Disability Insurance. SSI, Supplemental Security Income, is an assistance program from the federal government for people who are over 65 or people who are blind or disabled with little income and assets. Okay, generally you have to be a citizen to get it. I mention this because probably this would be in the case if you have a child with serious disabilities. If you're not yet getting Social Security, then SSI could provide an income for that child and also Medicaid coverage. Okay, so now the SSI can only be received in the US. There's a lot of limitations as far as income and resources go. The SSI check is received on the 3rd of the month, whereas the Social Security check is usually received on a Wednesday, 2nd, 3rd, or 4th Wednesday, depending on what day of the month you were born. All right, so until a child is 18, income and resources of parents or step-parents are counted as though they were the child. So we have a lot of children that have a serious disability that might otherwise be approved, but they're under 18, so mom and dad have too much income. But once the child turns 18, even though they're still living with mom and dad and dependent on mom and dad, now we are not counting anything of mom or dad's. Okay, so for more information or to get our website, go to socialsecurity.gov, ssa.gov, either one, and that's how you can make the phone appointments also. Okay, I'm through now, and I guess we can go to the chat box, right, and see what the questions are.
Yes, we have quite a few questions. We're going to try to get through as many as we can.
Yeah, if I can't, whatever I can't answer, just forward those questions to me at andy.hardwick@ssa.gov, and I'll be glad to answer your question. What is the maximum benefit anyone can get? Probably around 3,000 plus. Sharing the slides, yes, we're going to share. How do survivors benefit work? Well, you have to have a certain number of credits, the person who passed away, and then, like I said, the widow or widower can get benefits, reduced benefits at age 60, but if they're working, that might cut into their benefit. Now, once they reach full retirement age, it doesn't matter if they're working or not, or if a widow is left with kids under 16, then the widow or widower could be any age. So they could get benefits until the youngest child turns 16. The kids get benefits until 18 or 19 if in high school, just like under retirement or under disability. Okay, when full retirement age and the income is evaluated each year, does it increase at 8% or is it decided on your year's earnings?
I'll
When
just
you're
go
full
ahead.
I'm sorry.
Why don't I just go ahead and read the question
Okay,
out,
sure.
and that way you can just answer. Okay,
Okay,
so I'll just repeat
okay.
this one. For example, at full retirement age and income, okay, so your income is evaluated each year. Does it also increase at 8%, or is it decided on your year's earnings? And what if your earnings are equal to a previous year?
When we're doing that, well, the 8%. The 8% is decided on your whatever your benefit amount is. But once as your benefit amount increases, because it increases every year due to the cost of living increase, or because you continue working. So if you can, the question was, what if I earn the same this year as I did last year? Well, even so, we're going to compare. Again, we're going to look at the 35 years. If whatever you earned for the year is higher than one of the 35 years we used, and chances are it probably will be, even if you work the full 35 years, chances are it's going to be higher than one of those 35 years. We'll take the lowest and we will recalculate your benefit.
All right, can a veteran use the VA for prescription or other medical needs to supplement Medicare.
Yes, yes, you can. But make sure just because you're a vet, you need to sign up for Medicare anyway. It used to be optional, it isn't anymore. So even though you might have coverage because you're a veteran, you need to sign up for Medicare.
All right, if a spouse has also worked after the partner passes, can they get both their own benefits and their spouse's benefits?
No, you get whichever one is higher. So if your spouse passes away, okay, let's say my spouse was getting $3,000 a year and I'm getting $2,500 a year. My spouse passes away, they give me the difference. They would give me an extra $500, so my benefit would equal hers. But let's say she's getting $2,000, I'm getting $2,500. She passes away first. I don't get anything as a widower because my benefit was higher than hers was. So if your spouse passes away and their benefit was higher, you get the difference. So your benefit equals theirs. But if your spouse's benefit was lower, then you don't get anything as a widower.
All right, and I think you meant like 2,500 or 3,000 a month, not
Right.
a year. Not a year. You said per year.
Oh, I'm sorry. Oh, I apologize. I mean,
we don't want to confuse people
no,
there.
No. I apologize. A month. Sorry about that.
All right.
The 8-month rule. Okay. No, the 8-month rule is if I'm working at 65 and I have health insurance to my employer, or if I am insured under a working spouse, when either she stops working or I stop working, if the health insurance is through my employer, then I have 8 months to sign up under the special enrollment period, 8 months. If I don't sign up, then I can only sign up during the general enrollment period, which is January to March of each year. So anybody who missed either the initial enrollment period or the special enrollment period last year has until March 31st, which I guess is Thursday of this week, to enroll in Medicare Part B, because if they don't, they'll have to wait till next year, till January of 2023, when the new general enrollment period starts. Okay. But again, if I'm working, I'm over 65, I'm working, I have health insurance, that's good. I don't have to file for Medicare. Now, sometimes people think, well, my employer continued my coverage past my, I stopped working, but I still have that. That does not count. Once you stop working, if it's through your employer, or your spouse stops working, if it's through your spouse's employer, the clock starts ticking. It's actually the month after you stop working, but the 8 months, you gotta be cognizant of that. If, okay, I stop working now, I'm over 65, I need to sign up within 8 months, or else I will only be able to sign up for during the general enrollment period, and I'm going to be paying for each year I was late. Now my premium will be 10% higher, and that will never go away. Unemployment is not included in the calculation of Social Security benefits.
I will just also interject here that Andy did a whole webinar with us about Medicare. And when we post this webinar recording on our website, you will be able to also watch that one as well. I'll make sure to link it in the posting. Okay, here's another question. When you have an ex-spouse, when they do they get a portion of your own Social Security benefits if they're using you to do spousal benefits?
Yeah, they will. Okay, they will get an amount equivalent to a portion, but that's not going to reduce your benefit or reduce the benefit of any current spouse you have. So you could have an ex-spouse and a current spouse receiving under the same person. That does not reduce the benefit of each other. They don't reduce each other's benefit, and they don't reduce the benefit of the person under whom they are filing either. So you could have a person also who, you could have several people filing or receiving benefits under the same individual. One as an ex, or maybe two as exes, and one is a current spouse. Maybe the person was married 3 times and 2 times each was married over 10 years. So those 2 exes have the right to file because they never remarried. And also the current spouse does also. You could have 3 people receiving under the same person, and one benefit doesn't cancel out the other.
Okay.
Is
And
Social Security taxable? Yes, it is. If your countable income is over countable gross income is over $18,000, it's going to be, and you file as an individual, your Social Security is going to be taxable. If you file as a couple, I think it's about $33,000. If your income is in excess of that, your IRS is going to make you pay taxes on your Social Security.
I have another one here. How does a child disability affect your Social Security benefits? Is that benefit lost for you?
No, it does not. It does not reduce your benefit at all. Now, childhood disability, no child gets a disability benefit from Social Security under 18 because we don't make that determination. The SSI, yes, that's possible because that's another program. That's the one I talked about in the last part of this presentation. The SSI, it is possible. But Social Security, we don't make disability determinations because we pay you on the basis of being a minor child. So any minor child of the wage earner who has died and with enough credits or is getting either disability or retirement, they can collect until they're 18 or 19 if they're in high school. But in order to continue receiving that benefit, when they're about to turn 18, then whoever's caring for them needs to contact us so they can fill out the disability report. And if the child is approved as disabled, then that child is considered a disabled adult child at age 18. And then at age 20, if they are designated at age 18 as a disabled adult child, at 20, they get Medicare coverage. Their Medicare card will come to the mail after 24 months of being on Social Security disability. But the earliest you can go on disability is age 18 under Social Security. SSI, yes, you can go on disability prior to that. But again, that's a different program. But for Social Security purposes, you have to be at least age 18. And then the earliest you would get Medicare would be 20. That's the Medicare, the red, white, and blue card, not the Medicaid. To get the Medicaid, you'd have to be on SSI. Now, with the SSI, the Medicaid is not portable. If you move to another state, you need to notify Social Security so we can send a referral to the new state for the Medicaid for that. The Medicare is portable, but if you're on a Part C plan, chances are that plan is not in other states. So you're going to have to, but you'll have like open enrollment. You contact Medicare, and then you can sign up for a Part C plan in your new state of residence. And Social Security can be received outside of the United States. SSI cannot. Okay. So if you're on SSI and you leave the country for 30 days or more, your SSI and Medicaid are suspended until you come back. Not so with Social Security. Generally, if you're a citizen, you can get Social Security almost anywhere in the world.
That's very interesting. Andy, we're almost out of time, but I'm wondering if we can stay a little bit longer and
Sure,
answer some more of these questions. I don't mind staying a little longer.
Okay.
All right. So this is a good question. Where on your W-2 can you find where the Social Security is taken out? What is it called again? I know you mentioned it before.
FICA, FICA. FICA, Federal Insurance Contributions Act, but it'll say either Social Security taxes or FICA, FICA.
All right. And then what is the maximum benefit that anyone can get?
A little bit over 3,000, maybe 3,400, something like that. You know, nobody gets 4,000, not at this point, not yet.
Okay.
Because we only tax your Social Security up to a certain amount. You know, you could be making $500,000 a year, but we're not taxing you up to that. I don't have it in my head. Let me see if I, yeah, it should be here. Yeah, it's this year, it's $147,000. So you could make $200,000 this year, but you're only taxed up to $147,000. Now, some people want to change that. They say, well, Social Security in 2034 is going to have a problem where unless things are changed, we'll only be able to pay out 75% of benefits, 75%. So some people say, why not tax the first $200,000 that people make? Well, that's one of the proposals. But any change to Social Security is always comes with controversy. One side doesn't like it, the other side does. One side wants this, the other side wants that. So it's just a question of the both sides coming together and doing things. There will be changes made before 2034. We're not going to get to the point where we tell people, well, sorry, we're going to cut your benefit by 25%. That's not going to happen. But if you've been following the budget, you see Congress always acts at the last minute. When you hear that government's about to close down, and then they suddenly come up with a deal, or they come with a temporary fix until the next time they can talk about it. That's generally the way it's done. That's unfortunate. It shouldn't be that way, but that's the way it is. So there will be changes to Social Security before 2034. But again, that depends on Congress.
Here's another question, and this one's about Medicare. Are capital gains considered income?
Oh yeah,
in determining
IRS considers, not for Social Security. We don't consider capital gains income, but IRS is going to consider that. Yeah.
for Medicare.
Yes. Yes. It's there will be. Yes, that will be considered. That will be taken. So not everybody pays the $170.10. Used to be, but when Medicare Part D came along, Congress said, oh, like everybody's paying at that time, Medicare was probably like under $100 a month, or around that much. And Congress said, well, that's not really fair. People that are better off should be paying a higher premium for Medicare Part B. Okay, so that's when they came up with this thing where depending on what your income is, your Medicare premiums may be higher. Now, your Medicare premiums for the current year are generally based on your income from 2 years ago. So if 2 years ago you sold a house and you had capital gains and your income went way up, then you may be paying a higher premium this year. But if last year your income went down, then for next year, for 2023, which will be based on your income for 2021, then your premiums should go down.
All right, one last question here, and then we're going to let people go. I know many of us have other things to get to, even though we could probably spend a whole day talking about this subject. So if you draw Social Security at age 65 and the amount was $2,000, and your spouse is 1 year younger, what percentage can you estimate if your spouse is drawing a percentage of your own? So it would have to be 1,000, but it would be adjusted to 800.
Well, it depends on what your spouse's age was. Okay, so your spouse would get one half. If your spouse was full retirement age when she filed for spousal benefits, she would get one half of your full Social Security benefit, not one half of your reduced benefit.
Okay, so let's say this person is 65 and their spouse is 64. I guess it would depend on their date of birth.
Yeah, and again, let me tell you, we have calculators at the Social Security website that can help you figure that out.
Okay.
So use our calculators, your benefit calculators. We have a whole bunch of them. Go and put those figures in. They will help you. They will give you those figures. Okay, much better than me trying in my head say, well, this is this is that. But those, they'll give you much more accurate figure there for benefits.
Well, that's all the time we have for questions. And I want to tell our attendees, if we haven't had a chance to get to your question, it's not because we didn't want to, it's just we ran out of time. So go ahead and leave your questions, and we will make sure someone reaches out to you to address them. I will save the chat on this really informative webinar. And oh, you're getting lots of thank yous from our attendees.
Thank you very much, guys. It's been a pleasure. God bless you all. Have a great rest of the day. Bye-bye now.
And I just wanted to thank our attendees, and once again look for an email for a replay of this informational webinar. Here at Advice Chaser, we're all about helping you find a financial advisor who's a great fit for your life and your financial questions. Our matching service is free to you, and every one of our advisor partners has committed to offer a free initial consultation to anyone we introduce them to. Find out more by going to advicechaser.com and clicking on the link to find an advisor. Once again, from Advice Chaser, thank you so much for coming, and we will see you at another webinar soon. Goodbye, everyone.